this video is for removing the bulky dressing and replacing the dressing post-op day 1 at 5:30 in the morning. We have already taken off the bulky dressing, the cotton, the ace wraps. We've already applied the TED hose on the non-operative leg. So the first thing you want to do is inspect the dressing, the Aquacel. It's usually this brown color. This one's different for education purposes. So you want to inspect the inner part of the dressing. If it's saturated to the edge of the dressing, you'll want to take it off. You'll clean it with 3 iodine swabs and then 3 alcohol swabs. You'll want to then let it dry a little bit because your dressing's not going to stick to the leg. If it's still bleeding, you'll replace it with this white island dressing. If it's not bleeding, you can replace the Aquacel back on there and then send them home with whatever dressing you put back on there if it's not saturated again. So we have the Aquacel, the new Aquacel on here. If you had to change it, if not the original one, you'll put the thigh-high TED hose on first. Make sure all the wrinkles are out of the TED hose. So you will start with a bigger ace wrap. And you'll want to have a second person with you to help hold the leg. So then you'll use 2 washcloths. You'll put the washcloths down before the polar care. Then you'll put the polar care down, the water side down. And then you'll use the second ace wrap and wrap around the top of the polar care. Then you'll use the small ace wrap to go underneath the polar care plug-in part because this still gets cold. post op. And then make sure to plug the Polar Care back in. So that is how you do a total joint dressing change. If you have any questions, make sure you ask your charge or go to Brandy.